Hello, this is Alex. Welcome to my channel where I discuss common health conditions and their treatments, both conventional and complementary. This video is part 2 on alcoholism, where I continue discussing health effects plus the causes of alcoholism and conventional treatments. In part 1, I discussed what alcoholism is, the symptoms, withdrawal symptoms, consequences, and some of the health effects. Lots of valuable information, so be sure to stay tuned until the end. Also, if you enjoy this content, please hit the like button, subscribe to my channel, and hit the notification bell and click all so you won't miss a video. Now let's get into this video. Fatty liver is a response to liver injury that is directly related to the nutritional status of the liver and the level of antioxidants in the liver. It is worse for a high-fat diet. Liver cirrhosis is also quite common in alcoholics. This is where long-term heavy drinking can cause the body to start replacing the liver's healthy tissue with scar tissue. As more healthy tissue becomes replaced with scar tissue, the liver will stop functioning properly. Alcoholism can cause metabolic damage to every cell. Alcohol is broken down and converted into energy, and it is acetaldehyde at the center of this chain, which is the weakest link. If acetaldehyde is not broken down further, it builds up in cells where it damages DNA in a way that could cause cancer. Heavy alcohol consumption can interrupt the flow of calcium in muscle cells. Calcium helps muscles contract. Therefore, doctors believe that because alcohol impairs the function of calcium in muscle cells, that it may reduce your strength. Alcohol can cause malnutrition by reducing dietary caloric intake, impairing nutrient digestion and absorption, reducing protein synthesis and secretion, increasing catabolism of gut proteins, and increasing breakdown and excretion of nutrients. Alcohol can cause high levels of cortisol, which can decrease bone formation and increase bone breakdown. High alcohol consumption also increases the parathyroid hormone, which removes calcium from the bone. Too much alcohol also kills osteoblasts, the cells which make bones. Heavy drinking can also contribute to pancreatitis, a painful and potentially fatal inflammation of the pancreas. The pancreatic acinar cells metabolize alcohol into toxic byproducts that damage pancreatic ducts, and enzymes that are normally released into the digestive tract build up and begin to digest the pancreas itself. The damaged pancreatic tissue promotes inflammation, which leads to further damage of the pancreas. Alcohol can also trigger flare-ups of psoriasis, which is an autoimmune disease that causes the immune system to overproduce skin cells. Alcohol can disrupt brain chemicals or neurotransmitters and can also interfere with the hormonal system, which is connected with the progression of most mental disorders such as anxiety or mood disorders. An alcohol addiction may suddenly show similar signs to psychiatric symptoms. Cardiomyopathy, often with arrhythmias, can also often develop with alcoholism. It may develop after 10 years of heavy alcohol abuse and is attributed to a direct toxic effect of alcohol on the heart muscle, independent of nutritional deficiencies. It is manifested as cardiomegaly and congestive heart failure, and pathologically usually as diffuse myocardial fibrosis and hypertrophy with glycoprotein infiltration. Thiamine deficiency associated with alcohol abuse can also produce a cardiomyopathy or beriberi heart disease with high output failure and cardiac conductive disturbances related to electrolyte imbalance. Excess alcohol can cause ECG abnormalities, arrhythmias, and sudden death in young alcoholics. Gastritis may be related to alcohol's effect on gastric secretions, which increase in volume and acidity while the pepsin content stays low. Depression is common among alcoholics and known to lead to the high suicide rate. Many alcoholics are depressed first and later become alcoholic, while others become alcoholic first and develop depression later. Alcoholics have depleted levels of tryptophan, which may explain the depression and sleep disturbances common to alcoholics. Brain serotonin levels are dependent on levels of circulating tryptophan and other amino acids which compete with tryptophan for transport into the brain. Intestinal microflora is very compromised in alcoholics. When the small intestine is invaded by toxin-producing bacteria, it may lead to malabsorption of fats, carbohydrates, protein, folic acid, and vitamin B12. The disturbance in gut flora may be the cause of the abnormalities of the small intestine commonly found in alcoholics. Supplementing with Lactobacillus acidophilus helps with trying to correct the altered gut flora. Alcohol also increases intestinal permeability to toxins and macromolecules. The ensuing allergic reactions and absorption of gut-derived toxins likely contributes to the many complications of alcoholism, and, considering the addictive tendency of food allergies, may also contribute to alcoholic cravings. Possible complications of alcoholism include Korsakoff syndrome, Wernicke's encephalopathy, cerebellar degeneration, and Macchia-Fava-Bignami disease. Korsakoff syndrome is a chronic memory disorder caused by severe thiamine or vitamin B1 deficiency. B1 deficiency is common in alcoholics because alcohol irritates the stomach lining and makes it harder to absorb certain vitamins. Wernicke's encephalopathy is a type of brain injury, again caused by thiamine or vitamin B1 deficiency. Cerebellar degeneration is a deterioration of nerve cells in the cerebellum. Signs and symptoms may include a wide-based uncoordinated walk, a tremor in the trunk of the body, uncoordinated movements of arms and legs, and slurred speech and involuntary eye movements. Macchia-Fava-Bignami disease is a rare disease involving damage to the protective coating of the nerves. Symptoms can include lack of consciousness, aggression, seizures, and depression. The causes of alcoholism remain obscure. Genetic, physiological, and social factors are believed to play an equal part in causing alcoholism. However, recent research shows genetics may be most important, and that finding a genetic marker could result in diagnosing it in its initial and more reversible stage. A number of studies have shown alcoholism is 4 to 5 times more common in biological children of alcoholic parents than in those of non-alcoholic parents. This suggests a biological marker may not be necessary for the implementation of an innocuous primary prevention program. The genetic basis has been supported by 1. Genealogical studies showing alcoholism is a family condition, 2. Studies of adopted children of alcoholic parents raised by foster parents demonstrating continued higher risk of alcoholism, 3. Twin studies showing differences between identical and non-identical twins, 4. Association with genetic markers, and 5. Biochemical studies showing enzyme levels needed to detoxify alcohol are lower in people prone to alcoholism. Although the incidence of alcoholism is higher in biological children of alcoholics than in their adoptive children, the percentage of children of alcoholics who are problem drinkers is only slightly greater than that of the general population. Many experts believe that alcoholism usually occurs in the context of a necessary genetic or biochemical predisposition. Some data suggests persons who become alcoholics are less easily intoxicated and have a higher threshold. Some experts distinguish between alcohol abuse, which may occur in any heavy drinker, and the chronic syndrome, which they believe only occurs in the genetically predisposed. Incidence of alcoholism is increasing in women, children, adolescents, and college students. Certain personality traits including schizoid, loneliness, shyness, depression, dependency, hostility, self-destructive impulsivity, and sexual immaturity are common among alcoholics. They often have a history of a broken home and disturbed relationship with their parents. Societal factors such as attitudes transmitted through the culture of child rearing can also affect patterns of drinking and consequent behaviour. There are several conventional treatments for alcoholism, one of which includes withdrawal. Medical evaluation is needed in the early stages to detect other illnesses that could be ruled out. For example, central nervous system injury might have the same symptoms as the withdrawal syndrome. Also, delirium tremens is very similar to the mental changes caused by acute hepatic insufficiency and therefore needs to be differentiated. Delirious patients respond well to reassurance and should not be restrained. Their fluid balance must be maintained, and they must be given large doses of vitamin C and B complex, especially B1 or thiamine. All patients who are starting to experience withdrawal symptoms are suitable for central nervous system depressant drugs, but not in all cases. Many patients can be detoxified without drugs, but with just psychological support and reassurance, provided the symptoms are non-threatening. A commonly used medication for treating alcoholism is benzodiazepines. The dose is dependent on vital signs and mental status. Rapidly acting barbiturates are rarely used, however, phenobarbital is useful. Phenothiazines are not recommended for severe delirium tremens because they may not control it and they lower the seizure threshold. However, hallucinosis responds to moderately large doses of phenothiazines. Disulfiram is a medication which interferes with the metabolism of acetaldehyde, a product which oxidizes alcohol, so that acetaldehyde accumulates, producing toxic symptoms and great discomfort. Drinking alcohol within 12 hours of taking disulfiram produces facial flushing within minutes, then enlarging of the blood vessels of the face and neck, then headache, tachycardia or fast heartbeat, hyperpnea or increased volume of air during breathing, sweating, nausea and vomiting follow, and may lead to low blood pressure, dizziness and sometimes fainting and collapsing. This reaction can last for 1 to 3 hours. Discomfort is so great that most patients will not risk drinking alcohol while taking disulfiram. The patient must also avoid drugs that contain alcohol, such as tinctures and elixirs. Patients and relatives should be warned that the effects of disulfiram may persist for 3 to 7 days after the last dose. The patient must cooperate and should be seen periodically by the doctor to encourage continuation of disulfiram as part of an abstinence program. The general usefulness of the drug has not been established, and many patients are non-compliant. However, some patients use disulfiram successfully. Disulfiram should not be used in pregnancy and in patients with cardiac decompensation. Naltrexone is an opioid antagonist which has been approved for treatment in alcoholics. Detoxification involves withdrawing from alcohol. After correcting nutritional deficiencies associated with excess alcohol intake, the patient's behavior must be changed to achieve sobriety, which is difficult. The patient should be warned that after a few weeks, when recovered from their last bout, they are likely to find an excuse to drink. They should also be told they can drink in a controlled manner for a few days, or, rarely, for a few weeks, but they will most likely drink without control again. Psychotherapy has also been recommended, but group therapy is thought to be more effective than one-on-one therapy. Finally, Alcoholics Anonymous groups provide the opportunity to socialize with others in a non-drinking environment and to share their journeys with each other. Thank you so much for watching this video. If you would like more information on this topic, please check out Part 1, which covers the symptoms, withdrawal symptoms and health effects of alcoholism, and Part 3, which covers the complementary treatments for alcoholism. I will link them in the description below. If you enjoy this content, don't forget to like my videos and subscribe to my channel for more informative videos on health and remedies. Also, feel free to leave a comment. Do you know anyone who has suffered with alcoholism? Have they tried any of the above-mentioned treatments? If so, have they been helpful? I look forward to sharing another video with you soon. Bye for now.